years, again I am going to meet. This is I am a new patient. Okay, new patient, because within the three, I just met him only one time only. Within the 3 years, I did not met him. I did not met again. On the 4th year only, and the meaning of new patient, established patient now?
Yes, ma'am.
Yes, did you understand? So, this is a way you have to identify the new patient and the established patient. Now, I just give a recall for you guys. Continuously join this. I don't know what to do. To give to visit with that specialty means patient is a new patient. From the second visit for the same specialty means patient is a established patient. When a patient get the treatment under the same specialty, same subspecialty means patient is a
Established patient.
Established patient. Suppose if a patient received the treatment under a different specialty means patient is a new patient.
New patient.
So the patient just meet the doctor only one time. Within the 3 years, he did not meet the doctor again. So on the fourth year, again he going to meet the same doctor means on the 4th year, patient is considered as a new patient. New patient. So these are the classification of new patient and established patient. This information is also present in our book. Okay, CPT book. Now, this is an example of specialty and a subspecialty. Take a note. Guys, the meeting will going to end. So please join by the same link soon. Please. Because present in our CPT. Now, usually for OP means we have a classification of new patient and established patient. OP means nothing but outpatient. So suppose if a patient is going to meet the doctor in OP means we have a classification of new patient and established patient. Suppose patient admitted into the hospital means we have a classification of, we have 3 classifications. On the day of admission, we should apply the code for initial day. Then for a subsequent day, that means on the following day, we should apply the code for a subsequent. On the day of discharge, we should report the code for discharge day. So initial day and the subsequent day, initial day and the discharge day can able to report only one time. On the day of admission, should report the initial day code. On the day of discharge, we should report the discharge code. So from the second day, we have to apply the code from subsequent day. Now, this is a classification we already discussed. Now, before 2023, that means up to 2022, we have to follow basic these 7 components. In that first 3 key components, based on that 3 key components only, we have to select appropriate code. But as per our 2024 guidelines, no need to check history, physical examination. Okay, no need to check history, physical examination. You just check the only. You just check the MDM or time only. MDM means medical decision making. So you just check MDM or time. If a time is mentioned means, if a time is present in your document means, no need to check the MDM. Based on the time, you can fetch the code directly. Okay. So 1 minute, I show that, see that this is the level of MDM. Straightforward MDM, low MDM, moderate MDM and high MDM. Straightforward MDM, low MDM, moderate MDM and high MDM. These are the level of MDM. Now, 1 minute, I show you the code description. After that, I will explain this table. Now, this is a code description of OP, office or other outpatient, straightforward MDM, 15 minutes 202, low MDM, 30 minutes 203, moderate MDM, 45 minutes 204, and high MDM, 60 minutes 205. Here, we have to fetch the code based on the time and the MDM only. MDM table is a very, very, very important for MDM table is a very, very important for evaluation and management. Okay. Fetch the code. If time is not mentioned, means purely based on the table only, we have to select the appropriate code. So what are the criteria we need to report the levels? Now, see that. Moderate MDM and high MDM. These are the corresponding table for MDM. Please listen. If you have any doubt, please ask. Okay. So in MDM, we have 3 tables. Table A, Table B, Table C. Table A for problem address. At the time of visit, what are the problem patient have? So cough, fever, cold, like that. So reason for that visit. So reason for that visit. In the reason of the visit, what are the problem patient have? So that is number of problem. Problem table. Then the table B is considered as data table. Collect the data. And based on that, doctor order any examination. And risk table. Risk means based on that test result, they take some decision for treatment. Doctor will take some decision for treatment. That is table A, B and C. Here, see that. Table A, B and C. So, there are 3. It's also called as column. 3 columns are 3 tables. Okay, 3 columns are 3 tables. Check that at the corner of that, the left corner of the table, check that. What is the statement is given here? In your left corner of the table, top corner. Level of MDM, based on
These 2 out of 3 elements of MDM.
MDM. 2 out of 3 elements of MDM. That means there are 3 tables. That means 3 columns. In that 3 columns, any 2 column must satisfied by your document. That is the meaning. There are 3 columns. That means table A, table B and table C. In these 3, any 2 column, that means any 2 table must satisfied by our A. So must satisfied by our document. Now, so what are the criteria we need to fetch the corresponding level? Means first, straightforward MDM. In straightforward MDM, patient have one minimal or self-limited problem. Minor, one self-limited or minor problem. Example, common cold, cough, fever. So these are the, so fever is minimum. Also go for low MDM. Minimum, but it will automatically go for, because with the fever, you definitely have any other condition. Am I right? Okay. So very self-limited or minor problem means only one. patient must, once I complete the table, I will share the example for each and every columns. I will share you. Okay, definitely I will share you. So one self-limited or minor problem. So patient must have only one problem. Cold. Please. Cold, common cold, cough, like that. But patient must have only one problem. So this is a self-limited or minor problem. So that's why there is no data column and risk column. There is no documentation for data and risk. So suppose if a patient meets the doctor with the common cold means it automatically, there is no another condition, only one condition. So it automatically leads us to the straightforward. And then for low MDM. In low MDM, there are 5 points are present in table A. In low MDM, there are 5 points are present in table A. In that 5, I need any one. In that 5 points, I need any one. Example, first one, 2 or more self-limited or minor problem. If a patient has only one problem means that is straightforward. If a patient has only one self-limited or minor problem means that will lead us to the straightforward. Suppose 2 problems, cold and cough, fever and cold. So if a 2 problem means that will lead us to the low MDM. Or one stable chronic illness. One stable chronic illness. What are the examples for chronic illness means? CKD, take a note. Chronic kidney disease, hypertension, stomach pain, diabetes mellitus, COPD, asthma. So these are the example, hyperlipidemia, COPD, CKD, hypertension, diabetes mellitus, hypertension, diabetes mellitus, hyperlipidemia, asthma. These are the example for chronic condition. These are the example for chronic condition. Okay. So actually, the duration for the chronic condition, patient must suffer by the problem at least 12 months or till death, until death. So patient must suffered by the problem at least 12 months. Then only we can consider as a chronic. Less than 12 months means the condition has considered as acute. For example, patient is suffered by the diabetes mellitus from the past 6 months. From the past 6 months, patient has suffered by the diabetes mellitus. This is an acute or a chronic condition? Acute. Acute, because the condition patient has suffered by the problem from the past 6 months only. But the duration for the chronic condition means at least 12 months or till death. Okay, must present 12 months. So as a default, diabetes mellitus, hypertension are considered as a chronic condition. As a default, hypertension and hypertension and diabetes mellitus are considered as a chronic condition once that provider explicitly denote the duration. Suppose if the provider denote the duration of hypertension means, based on that you can consider as acute or chronic. Based on that, you can consider as acute or chronic. Otherwise, as a default, we should report the code for chronic. So only one chronic condition, but in stable. So stable means controlled. Take a note. So the term stable, another term for a stable is controlled. Controlled diabetes mellitus, controlled hypertension. So that means the condition has been stable. So that will get 1 point. That means only one condition must have. If a patient has only one stable chronic illness, means that will get 1 point. Or one acute uncomplicated illness or injury. For example, abrasion, sprain, like that. Patient has only one acute condition or injury, illness or but uncomplicated illness or injury. Abrasion is not a complicated, am I right? Abrasion, swelling, like that. One acute illness or uncomplicated illness or injury means that will get 1 point. Or one stable acute illness. So like acute, that means controlled diabetes mellitus from the past six week or past 6 months. So this is acute condition. From the past 6 months, patient has suffered by the problem of diabetes mellitus, but the condition has been controlled here. So one acute stable illness, that will get 1 point. And the last one is one acute complicated, uncomplicated illness or injury, but requiring the hospital admission or observation level care. So due to patient age or due to physical concern of patient, due to patient age and due to the physical concern of the patient, patient has an uncomplicated illness injury, okay, uncomplicated illness, but patient admitted into the hospital due to patient physical concern or due to patient age. So that will get 1 point. So there are 5 points in problem address, that means in table A. From these 5 points, we need any one. Did you understand?
Yes, ma'am. Yes, ma'am.
Actually, I admit him 15 minutes ago. Chavan, I admit him 15 minutes ago. Till now, he can't able to join. You need to check that how many categories that are present in table B in a low MDM. How many categories? 2 categories.
2 categories.
Category 1 and category 2. Check that. Requirement of at least 1 out of 2 category. Am I right? At least 1 out of 2. That means there are 2 categories that are present in low MDM at table B. In these 2 categories, any one category must be satisfied by your document. There are 2 categories present in low MDM. In these 2, any one category must be satisfied by your document. Then category 1. In category 1, how many points are given here in category 1? 3 points. In category 1, there are 3 points. In that 3 points, any 2 we need. Check that the beginning of the line. Any combination of 2 from the following. Any combination of 2 from the following. So that means there are 3 points. From these 3 points, we need any 2. From these 3 points, we need any 2. So then each and every point that has a separate use. For example, point number 1. Review of prior external notes. Each unique source from each unique source. That means If a doctor review the patient and a doctor, so each will get 1 point. If a doctor review the patient previous health report regarding of, for example, now patient meet the doctor for screening or whatever it is, or a patient meet the doctor for some reason, and the doctor review the patient previous health report. So if a patient has a previous 1 year before, patient had suffered by the problem of breast cancer. So doctor review the health report regarding of that breast cancer, as well as now patient also have some diabetes mellitus related condition. So the current that means the current health record is also reviewed by the doctor. So if a doctor review the prior external note, prior means patient previously had a record. The record has been not taken newly. Patient previously had a record. So patient previously had a record. So each, if suppose if a doctor review 2 different record, means each will get a 1 point. Then review of the test result. So the first point that indicate doctor review the previous health report of the patient. Then second point, doctor review the current test result. Review the current test result. Review the current test result of blood, current test result of urine sample, means each will get 1 point. Suppose if a doctor review the current test result of blood and the urine, means so it will get 2 points, because blood test, the doctor review the test result of blood as well as urine. So each will get 1 point. So it obviously go for 2 points. Then order of each unique test. Order of each unique test. That means if a doctor newly order the test. If a doctor newly order the test. For example, if a doctor order CBC, completed blood count, and the ECG. So how many tests are ordered newly here? 2 tests. So it automatically lead a 2 point. No need to check the first and the second. Okay, so I directly get a 2. You suppose if I directly get a 2 point from these 1 means, no need to check the rest of the component. For example, doctor order CBC and the ECG. So there are 2 tests. So newly added 2 tests. Each test will get 1 point. So that's why I am getting the 2 point directly from ordering of each unique test. So no need to check the point number 1 and 2. Did you understand the meaning?
Yes, ma'am.
Yes.
Can you explain with examples, ma'am?
Ma'am,
Ma'am, that means each test will be counted as 1 point, ma'am. Like
yeah,
as you
each.
said, and ECG means so it will be counted as 2 points.
Yeah, each test that has a single point, that has a 1 point. For example, if doctors order urine test and a blood test. So how many tests are ordered newly here? 2 tests. 2. So 2 tests, that each test will get a 2 point. Each test will give a 1 point for us. So we directly get a 2 point from the last ordering of each. No need to check the second point and the first point. Actually, okay, doctor directly get a 2. We are directly getting the 2 point from the ordering of each unique test. So no need to check the point number 2 and 1, because for this category 1, we need 2 points only. Am I right? For this category 1, we need 2 points only. That 2 points automatically directly get from the ordering of each unique test. Means no need to check the point number 1 and 2. Did you understand now?
ma'am, it's the same for even the first 2 points, right, ma'am? For review of prior
Yes.
external review of the result
Yes,
as well.
yes. Not only for that last one, the same for the first and the second point. If you are directly getting the 2 points from review of prior external note, means no need to check the review of the test result and the ordering of each unit test.
Okay.
Okay?
Yes, ma'am.
Okay. Then OTC. OTC means over the counter. Suppose if a doctor refer any OTC means that will directly lead us to the low MDM for the table C. Over the counter. What is the meaning of over the counter? Means without doctor prescription, we can buy some medicine directly from the pharmacy. Paracetamol, Calpol, then what are the tablets? Any other? Cough syrup. Usually, cetirizine. So without a doctor prescription, without a doctor prescription, we directly buy the medicine from the pharmacy. So that type of medicines are called as OTC. Can we buy the cancer-related drug directly from the pharmacy without a prescription of doctors? No. So that type of medicines are prescribed drugs. That type of medicines are called as prescribed drugs. OTC, without a doctor prescription, we can able to buy the medicine directly from the pharmacy. So if a doctor refer OTC,
Voice is okay.
Am I audible now?
Yeah.
Okay. Now, check the last thing. Plan. Start OTC. Here, doctor give a OTC. OTC is given here. So, if OTC is given means that will lead us to the level of low level. So OTC is given here, low level. OTC is given here. So that's why it directly, low level, directly lead us to the low level. Clear now? Is there any doubt in this table? Any doubt? Okay. Shall I move to the moderate MDM now? Moderate. In moderate, a problem matters how many points are present. How many points are present? 5. In that 5 points, I need anyone. Okay, from the 5 points that are present in moderate MDM, in that 5, I need anyone. Point number 1. 1 or more chronic illness with the exacerbation. In that low MDM also we have one chronic illness, but condition is stable. Check that. Here also we have a chronic illness, but condition is stable. That means condition is controlled here. But in moderate MDM, condition, the chronic condition has been progressed here, worsening here, progressed here. For example, CKD stage 1 to stage 2 or CKD stage 2 to 3. That is, condition is progressed from lowest severity to highest severity. So that will lead us to the moderate MDM. Or 2 or more stable chronic illness. If 1 stable chronic illness means that will lead us to the low MDM. 1 stable chronic illness. Check that. Here, see the second point of low MDM in table E. 1 stable chronic illness. If a patient has 1 in control, that will lead us to low MDM. For 2 stable chronic illness means that is moderate MDM. But condition must be in controlled condition, controlled diabetes mellitus, controlled hypertension, like that. Please mute yourself. Please mute yourself. The meeting will going to end within 10 minutes. So rejoin by the same diagnosed new problem. Patient now have a one new problem, undiagnosed new problem. So, cyst. That means the character of that mass or lesions are not identified now. Okay, not the characteristics of mass or lesions are not identified now. So that is one undiagnosed new problem. Example, mass lesion. Take a note. So if a patient has only one undiagnosed new problem, that will get 1 point. Or one acute illness with the systemic symptom. Example, COVID-19. In 2020, we are giving the high level for COVID-19. In 2019 and 20, we are giving the high level MDM for COVID-19. Now, we are giving the moderate MDM because the condition has been controlled. So that's why we are giving the moderate MDM. So here, for example, COVID-19. COVID-19, one acute condition, COVID-19, it affects the respiratory system as well as the nearby system also. Am I right? COVID-19 not only affects the respiratory system, it also affects the cardiovascular system and the urinary system also. Am I right? So one acute condition, it will affect the systemic symptoms. That means nearby system also. So that will get 1 point. And one acute complicated injury, for example, laceration. So fracture means it will lead us to the high MDM based on the criteria. And for laceration means that will lead us to the moderate MDM. One complicated injury. One complicated injury means that will get 1 point. Is there any doubt in this table A? Any doubt? Guys, am I audible? Okay.
No,
Then take the table.
Ma'am,
Okay.
complicated injury means what, ma'am?
Condition has been worsening. For example, laceration. Laceration is the deepest wound. Okay, laceration, then skull contusion, like that. So this is a complicated condition. Injury. Injury means traumatic injury. Due to hit or due to accident, if a patient admitted with any of the complication means that will get that will lead us to the moderate injury. Laceration, contusion, then that will contusion of skull, so like that. Did you understand? No. Then in table B, how many categories are present here? Three. In that three, how many categories we need?
At least one.
So 1 out of 3. 1 out of 3. See that the first line of that table must meet the requirement of at least 1 out of 3. 1 out of 3. There are 3 categories. In that 3 category, I need any one category must be satisfied by our document. Okay. Then category 1, we already discussed that all these 4 points we already discussed in low MDM. Review the prior external note, review the current test result, ordering the each unit test. Actually, explain about the category 2, independent historian. Independent historian is nothing but patient attendant. For example, patient is a 3-year-old baby. The baby can able to explain their disease condition for a doctor. Baby can able to explain the disease condition. No. In that case, mother will explain about the condition, about how many times they get vomiting, how many complications that are present for that baby. So everything should explain by his or her mother or caretaker or parents, husband, wife, like that. So they are called as independent historian. Apart from the patient, if any other third person explain the patient health condition, means they are considered as independent historians. Apart from the patient, if the third person will explain this is all these 4 points are clubbed in this single category. First category 1. Check that there are 3 categories in moderate NTM. In that 3, I need any one category. Table. In 4, how many we need? Guys, check the category 1 of moderate 3. Check the category 1. There are 4 points in category 1. 1.
3
any
points.
combination of 3 points. Any combination of 3. So there are 4 points in category 1. From that 4 points, we need anything. Same like that. If a doctor, for each unique source, we have get 1 point. So review the prior external note, review the test result, ordering the each unique test, and assessment taken from the independent historian, means each will get 1 point.
Ma'am,
And category 2,
I have one.
yes,
In category, in moderate 1, category 1 or category 2 or category 3, then we have to satisfy only any one category, otherwise all are.
yeah. Any one category. As I told you already, there are 3 categories. In that 3 category, any one category must be satisfied. Okay.
In
So
one,
at the
there is a.
one category. See that at the top of the table must meet the requirement of at least 1 out of 3 categories. At least 1 out of 3. There are 3 categories. In that 3 category, any one category must be satisfied by our document. Did you understand now?
Yes, ma'am.
Okay. Then if an individual who give a interpretation, that means if an individual who give a result of the test, means that is interpretation. So suppose if a doctor give a result of the test, means category 2 will satisfy. So if an individual, that means here individual means physician. If a physician give a test result, means that means doctor examine the images and find out the result and give the patient. The result has been found out by the doctor. But in that previous, in category 1, second point, review the test result, means the interpretation not given by the doctor. He just review the test result only. The result not given by the doctor. So if a interpretation, that means result will given by the technologist. Okay. So here now doctor just review the test result. But in category 2, doctor find out the abnormalities and give the result. Did you understand the meaning of category 2? Actually, I'm a technician. You order an X-ray for a patient. I just take the X-ray and I am also give the I find out the abnormalities and give the written report. And you are a doctor, you just review my written report. Who find out the abnormalities here? You or me? Me only find out the abnormalities. Okay, me only find out the abnormalities and give the written statement. You just review my written statement. That's it. You did not find out any abnormalities. So that is review of the test result. Interpretation of the test means doctor, for example, usually if a nurse take the X-ray means based on that X-ray, doctor find out the abnormalities and they give the result. Here, nurse did not give the result. The nurse just take the X-ray. Nurse just take the X-ray. But doctors only analyze the image and find out the abnormalities and give the result. So that is interpretation of test. Did you understand now?
Yes, ma'am.
Oh. Then category 3, discussion of management of test interpretation. Doctor discussing the test with result with another doctor. So doctor, you and me are discussing with the result of a patient. Okay. A doctor discussing the test result with another doctor. That is discussion of management or test interpretation. Did you understand the third category?
Yes, ma'am.
Okay. Then risk table. Prescription of drug. We already discussed that. OTC means that will lead us to the low MDA. Prescription means without doctor prescription, we can't buy the medicine directly from the pharmacy. So that type of medicines are called as prescription drug management. So we have some website here, drugs.com. If you I don't have a laptop now, otherwise I will show you the website definitely for you. But in your we did not view the information. If you have a laptop, check drugs.com. This is one of the websites. Once you are entering the medicine name in that website, it automatically tells us about is this a prescription only or this is a OTC. So the information given by that website directly. So the coders are using the website. Based on that website, they are finding out the drug is OTC, the drug is prescription. In your CPC exam, you can't able to use that website. So don't worry, doctor directly denote that the OTC. Okay, the name of OTC directly given by providers. Don't worry. Remark number 2. After taking the decision for minor surgery, and the risk factors is also discussed with the patient. Please mute yourself. Please mute. Take not on your microphone. Okay. Then if a doctor taking the in this 4 point, I need anyone. Then the last third point is decision regarding of major surgery, but the risk factor is not identified with the patient. Risk factor not discussed. That means risk of the surgery. Risk of the surgery, that is called as risk factor. Risk factor is not discussed with the patient. That will get 1 point. Then diagnosis or treatment limited by social determinants of health. That means due to environment, the condition has not been progressed. For example, guys, please listen. patient suffered by skin problem. Patient working in leather factory. I think everybody know that leather factory. So patient is working in leather factory and he also suffered by the skin disease. Taking the medication and follow the prescription to follow by the patient regularly, but the condition has not progressed. Why? Because once he get the treatment from the provider, means he wants to go to the patient wants to go to the factory again, because due to that factory only the condition has not progressed here. Due to the environment, due to the factory only, the condition has not been progressed here. So that time, due to environment, due to money, patient does not have a sufficient money to buy the medicine, because so the condition has not progressed. So for some of the condition has not progressed, means that will get 1 point. Did you understand the meaning of the last point? Did you understand the last point? Please say yes or no. Okay. So there are 4 points in risk column. From these 4 points, we need anyone. Then we are going to discuss about high MDM. High MDM. One or more chronic illness with a severe exacerbation. One or more chronic illness with severe exacerbation. So the condition that reach the severity, final stage. So that means CKD stage 5 to reach the ESRD. Okay, that is the condition that reach the final stage. One or more chronic condition that reach the final stage, that will get 1 point. Or one acute illness, one acute or chronic illness that processes through to the life-threatening. For example, kidney failure, lung failure, cancer, HIV. So these are the life-threatening conditions. So if a patient has any acute or chronic life-threatening condition, means that will get 1 point. So if a patient has acute or chronic, will get 1 point. Voice is breaking. Did you understand? Okay. Am I audible now? Am I audible? Okay. Then there is no change in data column. Same like that. The informations are same in both moderate and high MDM. That means the categories, category 1 and 1, 2, 3, both are same. All are same in both moderate and high MDM. So what is the difference? Check that. Same. The content are same. There is no change.
2 categories are needed here.
Super. So for moderate MDM, we need any 1 category, 1 out of 3 for moderate. For high MDM, 2 out of 3. But the content are same. Informations are same. There is no change. For moderate MDM means from these 3 categories, any 1 category should present in our document. For high MDM means there are in these 3 categories, any 2 category we need. That's it. That is the difference. And for high MDM, drug therapy requiring intensive monitoring. Suppose if a patient admitted into the ICU unit, or a patient isolated to avoid the toxicity for monitoring means. So simply patient admitted into the critical care, that means high intensive procedures, high monitoring service means that will get 1 point. There are 6 points in this risk column. In these 6, I need anyone. Then the second point, major surgery discussed. The major surgery identified with the patient and the risk factor is also discussed with the patient. Okay. So patient do not have a family. So in that case, doctor want to discuss their risk factor with the patient only. Am I right? patient do not have a family. Patient is an orphan. So in that case, doctor want to discuss their disease condition, discuss their risk factor regarding of surgery with the patient only. So that will get 1 point. Discussing of major surgery with the patient. Then discussing decision of emergency major surgery means if a doctor take the decision for emergency major surgery means that will get 1 point. If doctor taking the decision for emergency major surgery means that will get 1 point. And so doctor take the decision to admit the patient into the hospital or de-escalate the hospital care. Okay, so that means discussion regarding for hospitalization or escalation. That means doctor take the decision to admit the patient in the hospital or take the decision. There is no improvement. Okay, there is no improvement, no chance to save the patient life. So that's why doctors simply tell their patient family members to discharge from the hospital care. So if a doctor takes the decision to admit the patient in the hospital or discharge from the hospital means that will get 1 point. Then the 5th point is decision not to resuscitate or de-escalation care because of poor prognosis. Because of poor prognosis. Doctor take the decision to de-escalate the care. That means to de-escalate the treatment because the condition has not cured. Okay, so no chance to recover from the condition like a HIV. Okay, like a HIV, no chance to.
What is the meaning of escalation and prognosis, ma'am?
Prognosis means condition has worsening, improved. Escalation means stop, they are discontinue the treatment. That is escalation. Discontinue from the hospital care or discontinue the treatment level like that. Did you understand now?
Prognosis means improvement or worsening, ma'am? Which one?
Both are same. Improvement. The condition is worsening from the initial one. Okay. Did you understand? Severe progress means that is severe. Condition has reached the final stage. Progress is nothing but improvement. The condition is increased. That the condition is improved. That is called as progress. Clear now? Okay. So due to poor prognosis, here the condition has not cured. So that's why doctor de-escalate the procedure. That means de-escalate the treatment, discontinue the treatment. So for that case, it will get 1 point. Prognosis means improvement. So then the last thing is, if a doctor give IV drug means that will get 1 point. Tomorrow I will share some IV drug during the classes. Okay, definitely I will share some examples for controlled IV substance. So if a doctor give an injection through IV means, and also give the monitoring. Doctor give the injection for a patient through IV, through intravenous, and the monitoring also taken by given by the provider. So that will lead us to the high MDR. So these are the components and the level of MDR. Did you understand any doubt? Any doubt? Because the entire ENM service should report based on that ENM only, a level of MDR only. That's why I am taking nearly more than 1 hour to explain this table. Any doubt? Any doubt?
No.
Okay.
No,
Then I
ma'am.
give I give a time for you. Take your own time. Read the table again. if you have any doubt, you can ask in our next session. I will definitely, if you have any doubt regarding a table means, definitely I will explain the concept, because take your own time, read the table briefly. Read the word. You must know the meaning of each and every word. Okay. So read the table. If you have any doubt, you can ask in our next session. So these are the level of MDA. Because if you have a clear knowledge in this table means, you can easily get the 6 mark from evaluation and management. Because in your exam, they did not ask the question based on the type. They purely ask the question based on the table only, based on the MDM only. Only on the rare cases only you can face any single question based on any, at the same time only one question you can, for luckiest person only will get a ENM question based on the type, but only one question only. But for the entire, in your CPC exam, they will ask the question based on the level of MDM only. That's why I give importance to explain this table. Actually, I did not explain the table based on the examination. So the same guidelines would be followed for the process also. For real-time coding also, we are using the same thing. So I am explaining the table. It is useful for both your process as well as for your examination. And you have to check the POS. POS is nothing but place of service. Place of service. So the entire E&M service should you report based on the place, based on the facility, in which facility patient receive the treatment. Based on that facility only, we have to apply the percentage here. See that. Use my screen. What is the code for place pharmacy? What is the code for pharmacy?
101.
Homeless shelter 101. 01. Homeless shelter
04.
04. School 03. That's it. Okay. So here, check the. Suppose in your CPC exam, if you are facing the question based on that place of occurrence means, place of service means, you have to check this table. Okay, you can easily get the number based on the place of service. Then check that what is the POS for IP. Use your book. Get your e-book or a hard copy. What is the code for IP? Check your book wise. Inpatient. IP means inpatient. Inpatient, what is the place of service code for inpatient? Okay.
21.
Okay. SNF, that means skilled nursing facility. Skilled nursing facility. 31. Urgent care. Urgent care. See my screen. Urgent care. 20. Okay. We'll check. This is correct. IP for 21. SNF. That means skilled nursing facility for 31. Urgent care for 20.
Yes, ma'am.
Urgent care for 20. This is the code of place of service. You can see the table in the first page. New patient 202225. First, you have to check the facility. In which facility patient take the service. So for outpatient means you have to check whether a patient is a new patient or established patient. For patient, the code based on the level of MDM or time. Straightforward MDM 20 to 15 minutes. Low MDM 30 minutes. Moderate MDM 45 minutes 204. And 60 minutes. These are the core sections. And same like that for established patient, guys, please mute yourself. Established patient, straightforward MDM, 10 minutes. Must meet the 10 minutes. Even 9 minutes also, you can't able to report the code. This guideline is not on established patient, but the NK servers breaking. Okay. Okay, fine. Am I audible now? Is it okay? Is it okay now? Okay, thank you. So as per our 2024 guidelines, for every ENM service, the time must be met. That means, for example, in 99212, establish a patient straightforward 10 minutes. Even 9 minutes also, you should not apply the code. Must met the minimum time. Must met 10 minutes. Even 9 minutes also, we should not apply the code. So that is the 2024 update. There is no change. That means in your document, provider must give a exact time for that service. Then straightforward 10 minutes, 99212. Low MDM 20 minutes, 213. Moderate MDM 30 minutes, 214. And high MDM 640 minutes, 215. What is the maximum time for a new patient? What is the maximum time for a new patient?
60 minutes.
60 minutes. The maximum time for new patient, 60 minutes. Then the maximum time for established patient is?
24 hours.
No. Maximum limit is 40 minutes. 40 minutes. So the maximum time for established patient in OP, 40 minutes. So apart from that 60, apart from that 40, if doctor spend extra time means for each additional, this is a new code, 417. This is a new code apart from that 60. Because for new patient means the maximum time will be 60 minutes. For established patient, maximum time is 40 minutes. Apart from that 60, apart from that 40, if a doctor spend extra time means for each additional 50 minutes, you have to apply the course. Example, so doctor, for new patient, doctor spend 2 hours. How can we report? 2 hours. Now I show you. First, you have to select the appropriate primary code. New patient, total duration 120 minutes. What is the primary code here?
Double 9205.
205. 99205. Super. 99205 for first 60 minutes. We have to apply the maximum time code. 99205. Then remaining how many minutes are that?
60 minutes.
60. Because 120 minutes, in that 120, for first 60 minutes, 99205. Then remaining 60 minutes, in that 60 minutes, how many 50? 450. So, we have to apply 99417 into 4. Okay. There are 2 hours. In that, for 2 hours, first 60 minutes, 99205. Then the remaining 60 minutes, in that remaining 60, we have 450. So that's why 99417 into 4. Did you understand? Any doubt, any question?
Ma'am, this code for both established patient and new patient?
New patient, yes. Both. See, this add-on code is for both new patient and established patient, but only for OP. Only for OP. Okay, clear? Any doubt? Yes.
It is little confusing, ma'am, the add-on code.
What's your
for the new patient, like for the example you gave right now, the primary code is 99205 for the first 60 minutes. So the remaining 16 minutes, below that code, it's given like for services 75 minutes or longer, use prolonged services, 99417, ma'am.
Yeah, that's it.
So why is it like 99417 into 4 and not just 99417?
Actually, suppose
Because
you have
they've not mentioned any like mention for each 15 minutes, or they've not mentioned
yes,
like
each each 15 minutes is given here. Check the line. Check the 99417. They mention each 15. Show the highlighted line above the highlighted line. Show the above the highlighted line. Each 15 minutes of total time. Did you understand? Check the what is the line? 1, 2, 3, 6, fifth line. Check the sixth line. The date of primary service is 15. Okay, that's why here we are splitting the remaining 16 minutes as a 450. Did you understand now?
yes, ma'am.
Okay, so the information is given here. That's why here we are splitting the code as each 15. Okay. Clear, ma? Any doubt?
No, ma'am.
Okay. Then nurse visit. So this is a code only for nurse. This is a code only for nurse. The nurse give the service in OP. Example, to measure the weight, to measure the pressure, temperature. For this service, not requiring the physician presence. Am I right? To measure the weight, to measure the height, then to measure the pressure, temperature. Usually, all of these services are done by nurse only, not require the presence of physician. So that's why this is a code only for nurse visit, but in OP. 99211, but this code not reported for nurse practitioner, training nurse. Okay, so qualified nurse only we can apply this code, but for nurse practitioner we should not apply the code. Take a note, guys. Very, very important one. 99211 for nurse only. Do not report the code for nurse practitioner. Up to 2023, we have a separate code section for IP and observation. Up to 2023, but from 22. But from 2023, we have a single code only. So if a patient admitted into the hospital or observation care, whatever it is, we have to apply the code from inpatient service. We have to apply the code from inpatient service on the day of admission. If a patient admitted into the hospital, on the day of admission, 99212 99223. On the subsequent day, from the second day, we have to apply the code from 31 to from the second day, third day. For each day, we should apply the code from 231 to 233. On the day of discharge, we should report 99238 to 239. Suppose if a patient admitted and discharged on the same day means go for 99234 to 236. Suppose if a patient admitted and discharged on the same day means you have to apply the code from 234 to 236. Now we are going to show you about the code description. You just check that the MDM are typed. That's it. On the day of admission, straightforward or low MDM. This code is applicable for both straightforward and low MDM. The same code will applicable for both straightforward and low MDM. 40 minutes 99221. Moderate MDM 55 minutes 99222. High MDM 75 minutes 99223. Then these three code sections for the initial on the day of admission, initial day.